everyone. Thanks for joining me for Unleash the Benefits, Boost Your Dog's Health with Exercise. It's Dr. Laurie here. I'm so excited to see you. Please let me know in the chat who's here, where you're from, and about your dog. Let me know their name, their age, their breed, whether they're young pup, an adult, an athlete, or geriatric. I'm live in the chat, so please let me know if you have any questions or anything I can help you with. We're going to discuss how exercise and what kind of exercise can affect your dog's quality of life, or in other words, their health span. Did you know exercise can increase longevity too? So you can actually have more time with your pup. We're going to talk about that and how exercise even affects brain health. This is basically information on what every pet owner or pet parent should know. Exercise is not just about walking or running your dog. That's great, and you need to do it. That will increase endurance and some strength, but these are two different types of exercise, strength training and endurance training. They do different things to your muscles and your body. Think about your marathon runners. They have lots of endurance, but they have smaller muscle size, and they don't have the strength of someone who works out with weights. We know for all the benefits of exercise, we need to work on both endurance and strength. That's the secret to exercising with your best buddy pal, your pup, cross training. Let's talk about targeted exercise, the things other than walking, running, or swimming with your dog. Targeted exercise decreases the chance of injury. It can help with decreasing obesity and being overweight. It decreases pain from arthritis without drugs, and it costs you nothing. And it even decreases the chance of doggy dementia. Why should you care? Did you know 3 to 5% of all dogs have cruciate disease? CCL in dogs, or in humans, ACL disease. It usually requires surgery. If you happen to have a Labrador Retriever, it's literally 5 to 10% of them have cruciate disease. And each surgery is anywhere from $2,000 to $7,000 plus rehab. 50% of these dogs need a second surgery within 2 years. From what I know, this can be preventable. Also, right now in the US, greater than 50% of dogs are overweight. That increases heart disease, cancer, lung and kidney disease. With exercise, we can significantly decrease this. Does your dog have arthritis already? Do you want to decrease the chance they get arthritis if they don't have it yet? With targeted exercise, we can decrease pain associated with arthritis without drugs and increase the stability in the joints to fix the root cause rather than just giving meds to decrease the inflammation and pain after they already have it. Did you know that more than 20% of dogs get canine cognitive disorder or canine dementia? By the age 14, 50% of dogs have doggy dementia. Without treatment, their life expectancy drops by 2 years. We want our dogs to live forever and feel great. We can help them do this. And if you stick around to the end, I have a special surprise just for you. What if you could be the reason your dog has less or no pain? What if you could be the reason your dog does not get arthritis or gets it years later than they would have? What if you could save your dog from the pain of knee or shoulder injury or surgery, and then the secondary arthritis? What if you could have a joyful, energetic dog living well into their teens? What if you could be the reason your dog does not suffer from doggy dementia? Doggy dementia, we are seeing it more and more in the veterinary world. Just think, you could be that person that everyone says, wow, your dog is how old? They look great. Now, why should you listen to me? I've been doing this for a very long time. I started the first veterinary rehabilitation clinic, designed the first underwater treadmill, and have had interns, people wanting to learn directly from me from 17 countries. I've been teaching on veterinary rehabilitation for more than 20 years. I've taught thousands of veterinarians around the world. I've written textbook chapters, journal articles. I even taught the veterinary rehabilitation certification course. It still wasn't enough. I have a driving need to teach as many people as I can how to help pups prevent injury and heal from injuries, as well as to have a happy, joyful lifespan and health span, long life, quality of life. I love teaching both veterinary professionals and pet parents. My driving force, what I wake up and think of every morning, empowering people, optimizing pets. I'm not your typical doctor. My goal is to help you be the best advocate for your pet. I practiced general medicine for 6 years, and then I sought new challenges beyond traditional medicine. I wanted so much more for my patients, not just drugs. I want to teach prevention rather than treatment. I commonly teach professionals on geriatric medicine, health span, lifespan, pain management, rehabilitation, sports medicine, and so much more. I'm always looking for new ways to learn and new ways to help my patients. Let me tell you the story of Sid, my soul dog. There, he's right here. He's always with me. He came to me at 11 months old with straight knees, which is a cruciate injury risk, straight shoulders, which is a shoulder injury risk, and a long back, which makes it more likely for him to have a back injury or iliopsoas strain. I looked at him and said, I'm a rehab vet. I am not going to let you get hurt. And from there, I learned everything I could about exercise and the best way to prevent injuries. And I want to share that with you. If you know me, you know I'm a science nerd. So let's start with some science. Did you know the College of Family Physicians of Canada say in their statement that after looking at all the research, that moderate exercise does not increase knee arthritis, even after an injury or with current arthritis? They say that exercise improves physical function, reduces pain and disability. They consider it an underutilized form of pain control for arthritis. We should be learning from that. What we see in general medicine, when we look at the typical progression of dogs as they age, what we see is they become uncomfortable, so they decrease their activity, which then decreases the strength of their muscles, tendons, and ligaments. When that decreases, their joint stability decreases, and then they become more sore. Our goal, and I have seen this for the last 26 years that I've been doing this, and why its rehabilitation started with me in a rented small space and is now the fastest growing field in veterinary medicine, is that we can make these dogs pain-free, increase their activity, increase the strength of their muscles, which then leads to more physical activity, and from that, improved quality of life. Science also shows that by improving muscle strength, power, and endurance, it prepares the body for strenuous activity. It decreases the risk of injury. Research has also shown that the stronger the muscles are, the more likely you are to have better posture, healthier bones, less joint injuries, less spinal pain, and injury. I love it when science validates my thought process. One of my heroes is Dr. Peter Attia. I listen to every podcast he puts out. Of course, he studies and brings in people that have done a ton of research to discuss how exercise affects what he calls the 4 horsemen of death, the things that kill almost all humans. Even though he's talking about humans, everything we know about exercise is similar in the dog and the human. The 4 horsemen of death, vascular disease, cancer, neurodegenerative or brain disease, and metabolic disease, things like kidney and liver disease, are the same things that kill most of our canine companions. All 4 of these can be affected by exercise. In fact, Dr. Peter Attia says that exercise is by far the most important thing we can do to increase health and longevity. Not only that, but he talks about needing 3 different kinds of exercise. And we see the same thing in the dogs. You need something that challenges proprioception or balance. You need strength training, which is our targeted exercise, and then endurance training, which is walking, running, or swimming. This is really cool. This is the brain of a young dog versus the brain of an old dog. Notice that there's less definition, the gray matter and the white matter, as compared to the young dog. We look at the ventricles. So this is where the fluid sits, CSF or cerebral spinal fluid. The ventricles are bigger in the older dog than the young dog, which means there's more fluid and less brain matter, less nerves. Also, the section marked H is the hippocampus, or the area of learning and memory. Can you see how much smaller it is in the old dog than the young dog? When dogs get older, they can get the doggy dementia or canine cognitive dysfunction. We see things like changing sleeping habits. They may hang out and just sleep a lot instead of interacting with the family, or they may pace and be restless. They may be apathetic and not really care what you do or what happens in the house. Or they may become extremely anxious. They may become more irritable and even aggressive. Think about older people. Sometimes they just get cranky. Dogs can be the same way. They may become more vocal. Woo, 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 woo. And of course, as they age, they can lose the ability to control their bladder and their bowels. We can slow this down and even reverse some of it with exercise. Studies show that exercise mice had a much bigger brain than mice without exercise. The mice tested higher in intelligence, exploration, total movement, and learning. They found that learning mazes actually caused the brain cells to live longer. Exercise also stimulates the heart and lungs. Studies noted that nothing shrinks the brain faster than being immobile or in a non-stimulated environment. I worry so much that so many dogs are faced with being in the house all day while their owners are at work. And then they don't get enough stimulation and exercise when their parents come home. If we can just add specific activities for at least 5 to 10 minutes a day, we can help their brains and their body so much. Exercise also helps stretch the fascia and the muscles for better posture and easier motion. It helps increase blood and lymph flow, as well as enhancing the nervous system for better body awareness and less chance of injury. Studies show that dogs' overall happiness increases with exercise, improving their quality of life. They are more joyful and energetic. With exercise, they sleep better, so you can sleep better. With moderate exercise, dogs commonly live well into their teens. My 98-pound Mastiff lived till he was 14. My Dachshund till he was 18 and a half. My Golden Retriever, even when he got bone cancer at 12, lived to be 15 and a half. And it's not just my dogs, it's in the research. There's less metabolic disease, diabetes, kidney disease, liver disease, heart disease when dogs are exercised, which means for you, less trips to the vet. They have more confidence and are less reactive. So they are literally better behaved. I love the saying, a tired dog is a happy dog. And of course, with exercise, we have decreased obesity. Studies show that if you just reduce the calorie count in humans and in dogs, you lose almost as much muscle as you do fat. Whereas if you add exercise and have the calorie restriction, they lose almost 100% fat. Okay, here's the fun part. Are you ready to play? We're going to do some kinesthetic learning so you can do the exercise too to feel what it feels like for your dog. Now, only do this if it feels right for you. If you have medical restrictions, talk to your doctor before trying any of these exercises. I want to teach you one of my favorite front leg exercises. It's the playbow. It's good for almost all dogs. It's super important how you do both the up and the down part of the exercise. This strengthens the trunk, the triceps, the biceps, the forearm muscles. By keeping these muscles strong, we're decreasing chance of any front leg injury and arthritis. In humans, this exercise is similar to the yoga poses downward dog, where the back feet and your hands are on the ground and your butt is up in the air, and then switching from that to upward facing dog, where your butt comes down and you push up with your arms. It's not exactly the same, but you use the same muscles that your dog will use. If you do this, you'll also feel your trunk muscles being used. So go try it. Okay, we're back. So here's magic. Notice I have my hand under her belly. I'm not lifting up, but I'm not allowing her to go down. This is actually me teaching her bow for the first time. I have a lure, a yummy treat. I have it in front of her nose, and I'm asking her to slide back and put her nose down between her front feet, and then come all the way forward, all the way, and reach forward with her nose. Let's do that again. This way you can see how it pulls her weight forward, and she's using all of the muscles in her front legs. It's also using her trunk. You can see after she does it a couple times, she's much more comfortable and understands the exercise. Dogs try to cheat. It's not that they're bad. They just want their life to be easier. The most common thing I see with dogs when they're learning how to bow is that their rear end will drop and they lay down, or they come straight up and they don't lean forward, which we need them to do to trigger activation of all the front leg muscles. One way to prevent them from dropping is to tickle their belly if they try to drop. The other thing to note is you have to bring your hand with the lure forward so they reach forward. The hand on the belly can prevent them from just stepping forward. Other things to know is you want to use a high value treat so their nose stays right next to your hand. And start with only 3 to 5 repetitions. Okay, here's one of my favorite rear leg exercises, and I need to let you know some really, really important things. This is a great exercise if, and only if, your dog can sit square. If the dog has one or both legs pointed in or out, when they go to rise, it changes the biomechanics in their knees, and they're more likely to injure their knees. Now, all shepherding breeds will have some outward rotation. This is normal, and it helps them get up and down easier. If you're not sure, ask your vet if their sit is square for their breed. An example of normal is this guy here. He's got slightly external rotation. So instead of being perfectly straight, he comes out, but that's normal for his breed. Now, whether it's a 16-week-old puppy, an athlete, or a geriatric dog, we have a challenge level that's perfect for them. And if you have a weak, older dog and rising from a sit to a stand is hard, we may only have them come halfway down and sit on your knee. I'll show you that in a second. And then come back up. It's like you're doing a squat, but only bending down a couple inches and then coming back up. Now, the average adult dog can do a sit to stand from the floor. And with an athlete, we're going to have them do a sit to a stand from a beg position. That shifts their weight much harder. This exercise helps strengthen the quadriceps and hamstrings, the basic thigh muscles of the dog, the calf muscles, and the gluteal or butt muscles of the dog. This exercise, when done correctly, decreases knee and hip injuries and pain associated with arthritis, knees, hips, and hocks. Okay, it's your turn to play along. If you're okay to play, you can squat down a few inches and come back up. I'll show you in a moment what it looks like with the dog. If you're strong enough, you can squat so that your thighs are parallel to the ground and then come back up. And if you're an athlete, you can actually add weight when you're doing your squats. Again, it's not exactly the same as a dog, but you can get to feel the differences and get an idea of what the dog is feeling. Again, always make sure your pup is sitting square. If your pup is weak and has trouble rising, you can have him sit down on your knee and then come back up. An easy way to do this is to put your hand in the Hawaii hang 10 position. Put your 3 middle fingers, we're going to stop right there. Put your 3 middle fingers between their body and their legs, with your thumbs over their pelvis and your pinkies behind their legs if you can reach. Don't push down, roll them back onto your knee. Once they're sitting on your knee, you can tickle their flank. I'll let you see it again. Here we go. Tickle their flank to have them come back up. I also use a verbal command like up, up, up. You can see me doing it here with Sid while Magic is looking on. And up. There we go. All right. The average strength dog can do a sit to stand using just their back legs. In this case, we want to have them come up and we hold their collar. Stop there for a second. There we go. We hold their collar or food right in front of their nose and have them step back with their back legs. I'll show you with Magic, who's just learning, and Sid, who knows exactly what to do. Again, here's Magic, just learning. She's not sure what to do. And then Sid, he's so good. He's like, okay, I know what to do. Stand up, just use my back legs. You can see how I'm holding his collar and then just asking him to sit and then step back. All right. And the last part of this is to have them sit square and come up into a beg position, rising into a stand, and then in a controlled fashion, come back down into the beg position. This is for very strong dogs. Just like us doing squats, doing one or two may be easy, but increasing the number can have a significant challenge. Also, like us, if you do exercises with too many reps or advance too quickly, you can make them sore. So you do need to be careful. All right. How do dogs cheat? They may have their front legs pushed forward into a sit. So if you see like this little guy here, his front leg is pushed in front. Look how that puts pressure on his back. We don't want him to be in that kind of position. We're looking more for the guy who has his feet squarely under him and their back nice and straight. All right, here's Magic. She is just learning this. And again, when I ask her to do it, she's like, I don't know what to do. But she's stepping forward. And that's the most common thing I see. Especially if you take the treat forward to ask them to come up, they're going to step forward. Why is that important? Because if they're doing that, they're using their front legs to pull and not their back legs to push. Now, there is a time when this is the right way to do it. If the dog has learned to sit on your knee and come up and on your knee and come up, and before they can do the kickback or the just step back with your back legs, this is a great way to do it. It's an in-between part. You'll see her again. She's just stepping forward. Praise, praise, praise. Only start with 3 to 5 repetitions. You can always build from there. One of my favorite trunk exercises is goosing. Woohoo! This is great for dogs who have weak abdominal muscles, as seen by having them have a sway back. And I'm going to show you what that looks like in just a minute. Now, we also don't want to do it if they have a roachy back. So sway back, roachy back. Goosing strengthens the abdominal and chest muscles, and that decreases pain in the back. By strengthening these muscles, it takes pressure off the back. Gravity has the biggest effect on the spine in the dogs, or any animals with 4 legs. And when gravity is pushing down, if the abdominal muscles aren't strong enough, the back gets really sore. This is going to help our dogs have better spinal posture. Only if you're comfortable and your back isn't sore should you try this. These are 2 common yoga poses. Yoga cat, which is having their back in that roachy position, and yoga cow, having it in that sway back position. Now we can do this on purpose to help our muscles stretch and contract. When we do it with the dog, we're causing that contraction to get to strengthen the abdominal muscles and take pressure off the back. Here you go. Here's Lulu. We have her standing square, and the first thing you need to do is get your intention to be tickled. If you don't have the right intention, they're not going to contract their chest and abdominal muscles. They'll just kind of sit in your hand. You can tickle the belly, you can tickle the chest, and you can tickle the flank. Some dogs will react to all 3, and some dogs will only react to 1 or 2. You want to hold that position for 3 to 5 seconds and then let them relax. Don't push up. Let them do the pushing up. Otherwise, you're doing the work and they're just relaxing. Again, praise is really important. Otherwise, you can just piss them off. And you want to make a game out of it. Start with only 3 to 4 repetitions. Here we go. I want to go over posture real quick so you can have an understanding of what a sway back dog looks like. That depression right there from weak trunk muscles, or a roachy back where it actually comes above a nice flat top line. Now, every breed is a little bit different, but for the most parts, breeds have a flat top line. Now, dogs like Whippets are always going to be what we would consider roachy in other breeds. This is normal for them. A great trick or tip for you would be if you have a small or medium dog, you can perform this exercise standing on the bed. This way you're not leaning over trying to tickle them. You don't want to put your own back at risk. If you have a tiny or small dog, you can even put them on a yoga mat like I have Sid up here. or any other non-slip surface. Put them on your kitchen counter, bathroom counter, wherever they're nice and stable, and you can perform it there. Remember, your biomechanics are just as important as your pups. So this is all great information and cool, but how are you going to put it into your everyday practice? Well, if you just wait until you remember to do the exercises, it may never happen. Things that I recommend doing would be to work your pup before they eat, so they're extra hungry and extra willing to do whatever you want them to do. Work them while they're eating. In other words, you can use their food to ask them to do the exercises. This is great if they're overweight or if you're watching their weight, as you're not adding any extra calories with treats. You can ask them to do the exercises while on a walk. Things like sit to stand or bow can be done if you're in the country, every house you get to, or if you're in the city, you can have them do it every time they cross the street. You can choose one exercise or alternate exercises. Another option would be to set an alarm on your phone. How many of us do this? 7 o'clock every morning, beep, 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 exercise your pup. Or 7 o'clock every evening, hey, you're home from work, do exercises with your pup. The very most important thing is each and every time you exercise, make it fun. Okay, now I want to tell you a story. You guys have seen the videos with Sid, and I've told you how Ollie, our Mastiff, lived to be 14. Well, when I adopted Sid, remember I said he had straight knees, straight shoulders, and a long back. And I said, being a rehab mom, I have to create an exercise program for you that will prevent you from having cruciate injuries, shoulder injuries, and back injuries. He did great with it, and so I shared it with friends. Laura, a friend in Chicago, started doing the same exercises with Sophia, her 9-year-old Sheltie, who was competing in agility. Her comment to me was, oh my God, I thought my dog was strong. I had no idea what she was capable of. She became one solid muscle. And at age 11, she was the 7th fastest Sheltie in bad dog agility, with all the other top 10 dogs being like 4 to 6 years of age. I took this information and created a professional course, Optimum Geriatric Exercise. We've had hundreds of vets go through it. It was not enough for me. I had to help more dogs. So I created Core and More foundational exercises for your dog. The same 24 exercise, but simplified for pet parents. It's all the exercises you need to keep them healthy, smart, and strong. Since we started this, we've had so many people come to us and say, we just want exercises for our dog's back end. So to help these dogs, we took 6 of the exercises from Core and More and created Core and More rear wheel drive. So why does this matter? The rear legs are the powerhouse of your dog. They control speed and agility for running and playing. And by strengthening the rear limbs, it decreases pain associated with hip problems and the chance of knee injury and surgery. For older dogs, the rear limb strength can be the difference between being able to get up on their own or not. And I can't tell you how many dogs have been put to sleep and their owners say, Doc, I had to put him to sleep. He couldn't get up on his own again. I don't want that to happen ever again. We can make that a non-issue. And the earlier we start with exercises, the less likely this is going to happen. Weakness is always going to happen with age, but we can greatly slow down the progression just a few minutes every day. And if your dog is already older, we can get them stronger. They may not be as strong as a young pup, but we can keep them as strong as possible to live through their golden years. So now you're going to ask, what's included in Core and More rear wheel drive? It starts out with some general exercise information that's super important to know. Understanding what fatigue and overheating look like, how to do a proper warm-up and cool down. From there, we have 6 exercises designed to strengthen the rear limbs. Each exercise is safe for a 16-week-old puppy all the way to a 16-year-old dog. It's perfect for any adult dog and even has progressions for athletes. There are lots of tips and tricks to help you work with a dog of any personality. I also cover you, the handler, your body position, what to do and what not to do. I even include red flags, what to look for, that if you see, you need to stop immediately. And some of these things, you may even need to take your pup to the vet. Knowing what to look for is so important. Safety is always extremely important. These are short, powerful lessons. They're easy to fit into your schedule. Each lesson is less than 30 minutes, and you get to see all kinds of fun with Sid, Ollie, and their friends. Why do I do this? Because Sid is a quick learner and does everything easily. Ollie, on the other hand, is very sweet, but not the sharpest crayon in the box. We have step-by-step guidance for each exercise. We also bring in other dogs so you can see the common mistakes both the handlers and pups make and how to correct them. Whether a dog is a beginner to exercise or advanced, this will help your pup be happier, stronger, and pain-free. It's just like Dr. Peter Attia recommends. These exercises cover strengthening, balance, and endurance. As always, we offer a 7-day money-back satisfaction guarantee. Between now and November 14th, we're offering an amazing discount. Core and More rear wheel drive, which is normally priced at $49, you can start helping your dog live a happier, healthier life for just $19. That's an unbelievable savings. Click on the link in the description below right now to start your pet having a stronger, healthier, longer life. Still not convinced? Let's see what other people are saying about Core and More rear wheel drive. Inga says, I'm always searching for new ways to help my dogs stay in peak condition. Dr. Laurie's Core and More rear wheel drive course was a great find. I love how she provided various approaches to each exercise, along with helpful photos and videos. It's so valuable to have exercises suited for dogs of all ages, from puppies to seniors. We want to help prevent injuries. Thank you, Dr. Laurie. Anne says, this course provides great fundamental information that applies to dogs of all ages. It explains how to keep your dog moving and why it's so important to keep them active. The format of the exercises is informative and provides details of all of the mechanics. Catherine says, keeping my dogs in the best shape to avoid injury is a priority. Dr. McCauley's course clearly explains each exercise with multiple ways to keep your dog engaged while doing the exercise correctly. I took this course with my 12-year-old Pumi, and I believe it will help her stay active. A key takeaway is the ability to tailor the exercise to your dog's level and pace. Every dog, whether a competitor or a couch potato, can benefit from this course. And Gail, with Striker, Steel, Splash, and Seeker, says, Core and More rear wheel drive is a fantastic program for dogs of all ages and abilities. Dr. Laurie offers clear exercise with step-by-step instructions, making the course both educational and enjoyable. Her passion shines through, making learning easy and fun. I started using the exercises with my 13-year-old Sheltie and already notice improvement in his movement. Highly recommend this course for anyone with an active dog, a senior dog, or any dog that needs to stay strong and active. All right, I'm done talking. Let's answer any questions you have in the chat. If you don't have any questions, I would highly recommend clicking on the link below to get started right now on an unbelievable journey of love, fun, healing, and bonding with your pup. Start today, decreasing pain, decreasing the chance of injury, decreasing the 4 horsemen of death, and increasing longevity, health, and fun.